And here we go. Spinal anatomy. It's winter 2022. It's week 2. It's Tuesday. Talking mainly about the posterior sacrum and some sacral conditions. We gotta not do pure anatomy, right? It'd be incredibly boring, I think, if you just did pure anatomy without showing you any clinical stuff. So we got some clinical stuff in here as well. All right, here we go. So posterior sacral structures. Remember, the anterior sacrum was a very smooth surface, not a lot of ridges or jagged lines. That transverse ridge was not really jagged, but that was the only thing that really stuck out. The posterior sacrum is a rough road. There's 3 mountain ranges. Really, you could say there's 5 mountain ranges as we'll go. There's a single median sacral crest and an intermediate sacral crest, which is just medial to the median sacral crest, and a lateral sacral crest. So let's go through this stuff. The median sacral crest, let's just go to the picture here. So this is a 3D reconstruction of a sacrum. So this is a posterior to anterior view. So we're looking at the person from behind. There's the PSIS's, posterior superior iliac spines. PIIS's, posterior inferior iliac spines, you can see real good. There's the coccyx, which we've studied before. This is a 2-level sacral hiatus, which we'll talk more about tomorrow. But yeah, this is a posterior view, and the reconstruction smooths everything out, so you can't really appreciate the ridges here. But I just wanted to show you kind of what we're looking at here. This is a sacrum from that same view. Coccyx would attach right here. This one has L5 kind of plugged into it, connected to it. But these are the things we're after here to start the lecture. Notice there's some little bumps here. They're just like spinous processes, but they're not as big. There's the L5 spinous process, which is much bigger compared to these little stubby things. Therefore, you can't call it a spinous process. So something smaller than a process is a tubercle. So these are called spinous tubercles or sacral tubercles. That's the S1 sacral tubercle or spinous tubercle of S1, S2, S3. S4 is a little funny looking, isn't it? It's kind of split. We'll look at that more in a little while. And then where's the S5? Well, the S5 didn't form because it's in this area of bone that didn't form. It's in that sacral hiatus, which we'll get to tomorrow a little bit. So anyway, these are rudimentary spinous processes, and they make up the median, not medial. Be careful of those words. Median means right in the midline. Median sacral crest is made up of spinous tubercles. Right? Simple as that. Then if we go lateral to the median sacral crest, we have another little crest here that is not much harder to visualize this. In fact, if I have my drawing tools here, we can have to kind of point these out. There's one right there. There's a little bump. There's another little bump right there. Right, there's another bump right here. And this one's a little mutated. This one's kind of split. So this is called the intermediate sacral crest. So median sacral crest, intermediate sacral crest, and then even further lateral we have, take a wild guess what that's called, the lateral sacral crest. So lateral sacral crest is right here. It's actually medial to these things. These are sacral fossa, which we'll talk about. I might have told you guys in lab wrong too. I might have said that is it, but it's not. It's over there. It's medial to these sacral fossae. Right? And there's kind of a bigger one there, and then they kind of go out wide like this. So that's the lateral sacral crest. right? These holes, they're just like what we saw last week. These are not anterior sacral foramen, though. These are posterior sacral foramen, right? So the intermediate sacral crest is medial to the posterior sacral foramen, and the lateral sacral crest is lateral to the posterior sacral foramen. Okay? And then, so that's one thing you have to know. Make sure you know the relationships to these things, because I could say something like the intermediate sacral crest is lateral to the lateral sacral crest. And that's false, right? It's medial to, it's located closer to the midline here. Right? The other thing we need to know is where these things came from, embryologically speaking. So if this is a spinous process here, let's pick another color. If this is a spinous process, we know what forms the spinous process. What does form the spinous process? It's the lamina. Lamina come together and the spinous process kind of grows off it. So this is the S3 sacral lamina right here. And then lateral to that we have these articular pillars. We have a superior and inferior articular process, but they're kind of melted all together on the sacrum. But where the superior and inferior articular process meet, they kind of bubble up into this little tubercle, and that has a name, and it's called the articular tubercle. So the articular tubercles, they give rise to the intermediate sacral crest. There's your note card if you're a note card person. What forms the intermediate sacral crest? Articular tubercles. What are articular tubercles? They're remnants of a superior and inferior process, superior and inferior articular process where they come together and kind of melted together. Here's a superior articular process, right? There's S1, superior articular process. There's an inferior articular process of L5, and we said they form the zygapophyseal joint, L5S1Z joint, or facet joint. There's another superior articular process with its facet. You can see a little bit of L5. So that's the deal with those. These, same kind of story. Transverse processes are out this way, but there's no transverse processes that we can see. So the transverse processes have melted together and pushed up these little bumps of bone. So those are called transverse processes, or those are called lateral sacral crest is made of transverse tubercles. Transverse tubercles. So articular tubercles, transverse tubercles, and we have spinous tubercles. So make sure you know what makes up all this stuff. Okay, so that's pretty much everything I said there. So you can go back and read it if you want, but that's everything I said. See anything strange here? If we look at this, what is weird about this? You're going to see this. It's found in about 5, then with 3 to, depending on what research you read, probably about 5% of humans have this. You'll probably see it in about, I would guess, 10, maybe even 15% of your patients, because it is associated with chronic back pain. Some of you have seen it. So if this is the L5 transverse process, or if this is L5, remember L5 is supposed to have a little airplane wing, right? What's happened? Yeah, these have massive airplane wings. So the transverse processes are hypertrophic. They're way bigger than they're supposed to be. And they have grown right into the ala of the sacrum. Right? A weird little hole is even formed here. Right? So this L5 bone has taken on characteristics of the sacrum. So we say that it's been sacralized. So this is sacralization of L5. You'll need to know that for the rest of your chiropractic lives, because you're going to treat patients with sacralization. A more general way, you can say that this is kind of a mutated segment, but we don't say mutated, we say transitional. So this is another way to say it is transitional segment. And there's all different types of transitional segments that you'll run into. When they're fused completely together, they're usually not that big of a deal, especially if they're fused on the other side as well. This one looks like it's pretty well fused together. But sometimes they form a new joint with the sacrum. Right? So this is a new joint that's formed right here. It's called a neoarthrosis, and that can be a source of pain, and it shouldn't be ignored by surgeons in particular. I'll show you a case where they completely messed up, and it turned out to be the pain generator. All right, so that's sacralization. You will encounter that term many more times as you go through the program here. All right, so this is a normal lumbosacral joint. There's the L5, there's S1 segment, there's the spinous tubercle, there's the spinous process of L5. Transverse processes look nice, like little airplane wings. There's the sacroala, or the lateral mass of S1 here. There's no connection between these, pretty much normal. Now take a look at this specimen. What do you see? Well, there's weirdness, isn't there? So let's see what's going on. There's 4 anterior sacral foramen. So this is S1, S2, S3, S4. This is L5. What has happened? Well, this side we have kind of a weird club-shaped transverse process. So that's kind of weird, but it's not that big a deal. But what's happened here? It's grown. The transverse process has grown right to the sacroala, and there's a new joint. It has, in life, it had synovial fluid. It has nerves that can carry pain, and it's quite degenerated because it's all rat bitten. We call that rat bite erosion. If we took an X-ray of that, it would look just like that, like a jagged, instead of smooth surfaces. It's all jagged looking. So that's called sacralization of L5 with a neoarthrosis. Neo means new. Arthro means joint. Cis means a condition. So neoarthrosis. A new joint has formed. Okay? So biomechanically, this is a mess. We're going to get some axial load transferred through this joint, and we're getting nothing over here. So that's why this thing is worn out like this. And I'm sure this person had back pain. I would state my reputation that this patient had a history of low back pain. Right, here's a case of mine a couple years ago. So a 52-year-old male, he's status post failed lumbar fusion. This is a case from India, and you can see that's the P to A view. Here's the iliac crests, and this is kind of a weird type semi 3D CT scan. You can see the sacrum quite nicely. You can see L5, and what do you see? Well, let's see. These are the pedicles right here. You can see the vertebral body quite nicely. That's right, I can draw, can't I? So there's the body. Right, there's the pedicles. The pedicles are the thickest part of bones. They always look like eyes. The spinous process looks like a nose. You always look for the eyes and the nose to make sure cancer doesn't eat the eyes away or make the eyes look too white. Transverse process over here looks great. Yep, some of you are going, oh yeah, it looks just like that cadaver, that bone specimen. Yeah, we got a sacralization. We have a new joint, a neoarthrosis, and it was never addressed by the surgeon, which is, and this, I mean, most surgeons in our country would know to make sure that's not a pain generator, but they didn't. So they fused 2, 3, and 3, 4, and the patient's miserable. It didn't work. So how do you tell if that's a pain generator? You send it to your pain management doctor that you should have on your team for things that you can't do that are out of your scope. and they injected it with an anesthetic, lidocaine, and the pain magically went away, completely went away for about 5 hours. Pretty good proof that that's the problem. So they have to extend the fusion down and fuse that. And I never know if the patient went through with that. I kind of lost contact with them. I don't know what happened to them, but that's what I recommended. And they had been through chiropractic and physical therapy and acupuncture and injections. Nothing was helping them. But nobody picked that up. So make sure you guys pick it up. Here's another one. 32-year-old male. Came in with low back pain. And you got to get used to reading these x-rays, because you're going to be reading them a lot. You should have a machine in your office. So here's the vertebral body. Right there. You got to kind of hallucinate in here and look carefully. There's a transverse process. There's a transverse process. There's the spinous process. There's the pedicle. There's the other pedicle. Okay, great. So if that sits at the level of the iliac crest, it's probably L4. Even though Cooperstein's research says it's L3. I don't see that. I see it's L4. So this is L5. So what's gone wrong here? Yeah, you guys got it. Same deal, right? Here's the transverse process. And this one is, I don't see a neoarthrosis. It looks like it's completely grown into the sacrum here. But the biomechanics are all messed up. So one joint's going to get overloaded. One joint's going to have too easy of a life. We have a new hole right here that we shouldn't have. So the posterior ramus of L5 is passing through a hole. And we'll look at some ligaments that can entrap that. And so there could be all sorts of trouble there. But yep, just another example. All right, and yeah, sometimes you can get, instead of sacralization of L5, look at this case. So here's a sacrum. It's S1, 2, 3, 4, 5. But this time S1 looks weird. L5 was normal. But S1 had a disc space, and it's supposed to have a transverse line. And S1 had a neoarthrosis right here. And that's the same deal we saw here in one of my patients. So this is a problem with S1. So this is called lumbarization. The S1 segment looks like a lumbar vertebrae. So it's lumbarization of S1. Okay. So sacralization of L5 and lumbarization of S1. And this one's got a pseudoarthrosis. Probably got one right here as well. So you'll have that again, but I will test you on that. You got to know that stuff, so make sure you understand. All right, so we already kind of went over all this stuff. So there's the median sacral crest. There's the intermediate sacral crest. This is a little better view. Maybe we can see it better. Okay, there's the, what are those called? Well, they're articular pillars, where the articular pillars come together. So these are articular tubercles are right here. And then the transverse tubercles, there'd be one right there, kind of one in here. These are kind of a little bit harder to see. On the real sacrum, you can, if we were in lab, we could see those things. Okay, so lateral sacral crest made by transverse tubercles. Posterior sacral foramen. All right. All right, everything I said. So intermediate sacral crest is made from articular tubercles. They're kind of where the rudimentary sacroarticular processes melted together and kind of fused themselves together. There's another view overhead. You can see them right here. I won't draw them again. I think you got it down. Lateral sacral crests, we already said that. Again, they're lateral to the posterior sacral foramen. They're made of rudimentary transverse processes. Rudimentary means they have the potential to turn into transverse processes, but they morphed into something else. And those are called transverse tubercles. Right, and there they are on the specimen. Great, just another picture to help you see these things. All right, posterior sacral foramen. So again, those are the holes there. There's 4 posterior sacral foramen. You should definitely know what goes out of that hole. That would be the dorsal rami of the same number. So out of this first one, the dorsal ramus of S1 comes out of there, dorsal ramus of S2, dorsal ramus of S3, dorsal ramus of S4. Dorsal ramus of S5 is a little bit different. We've talked about that a million times already. Remember, the coccyx would be right here. We'll just draw CX1. Looks like it's kind of rudimentary disc left there. But remember, there's that lateral sacrococcygeal ligament that fuses to the transverse process of CX1, and it makes a hole. So the question is, what goes through that hole? And it's actually the anterior or ventral ramus of S5 comes out of the sacrohiatus, and it goes through that hole and goes down into the pelvis. The posterior sacral foramen just comes out, or the posterior sacral ramus just comes out like this and goes down to do its job. It does not go through that hole. Only the ventral or anterior S5 ramus does that. Okay, so kind of complicated. This is complicated, but you got to know this stuff. Let's look at the wiring. So this is an overhead view or an axial view of the S2 segment. And it's been, the S1 has been cut and lifted off, so you can see a canal right here, the sacral canal, sacrovertebral canal. And at S2 is about the end of something called the thecal sac. And that's the thecal sac goes from the skull all the way down to about S2. And it contains the spinal cord, and at the level of L1 the spinal cord ends, but the nerve roots keep going, and nerve roots actually rip out the bottom of this thecal sac, as we'll learn next time. But anyway, all the way up the spine we have kind of the same design here. There's a sensory root. I guess I can draw this, can't I? There is a sensory root that comes out, and then there's a motor root which goes to muscles that comes out. You can always tell this little hump right here is where the nerve cell body lives. And they mix together right here. We'll make this red. These two mix together, and this should be a little bit longer. I did this in Photoshop. But this little segment right here, that is the spinal nerve, where the motor and sensory roots come together. So that's the S2 spinal nerve. And it's very short-lived. The spinal nerve quickly splits into 2 pieces. It splits into a piece that goes to the front or anterior, so that's called the anterior ramus, and it splits into a part that goes backwards, and take a wild guess what that's called. That's the posterior or ventral ramus. So anterior or dorsal ramus. So we have anterior ramus, aka ventral ramus, comes to the front, comes through this hole. What was that hole called? Anterior sacral foramen. Then we have a posterior or dorsal ramus that goes through this one, the posterior sacral foramen. See how that works? So this is unique. Only in the sacrum do you have holes for the rami to come through. The lumbar spine, thoracic spine, cervical spine, there are no holes. The rami don't have anything to travel through. And then we still have a intervertebral foramen, or a neural foramen, whatever you want to call it. So this is called the sacral intervertebral foramen. And that's where you can find the spinal nerve and the dorsal root ganglia live right in this piece of bone here. So very important. Make note cards of this. You need to know all this stuff. This is a super important slide. You can put like 1,000 stars on it. All right. Not many slides, but they're kind of juicy, some of these slides. The sciatic nerve, you might as well put this in your memory banks right now. Sciatica is a horrible thing. I've lived with this since 2002. Never gotten rid of it. Tried surgery, made it worse. And I'm an expert in sciatica because I have it. So you need to know all about this. You're going to treat hundreds and thousands of patients with this condition. Most of the time it gets better, but a couple percentage of the time it ends up like me, where it never gets better and you deal with it your whole life. So sciatic nerve, you need to know what roots make up the sciatic nerve. So it comes from the ventral rami, so the ones that go to the front of L4, 5, and S1. Those are the main clinically important nerves that contribute to it. And also not so clinically important, these things are inside the sacrum and they don't get pinched by anything usually. S2 and S3. So it comes from the ventral rami, aka anterior rami. But L4, L5, and S1, you're going to be treating people with inflamed L4 portions of the sciatic nerve and L5 portions of the sciatic nerve. Or maybe they have two of these nerves going off. So definitely know who makes up the sciatic nerve. All right, let's do another case. You're going to see a case like this probably every week if you're really busy. Especially if you work in a multidisciplinary environment, you're going to see this all the time. 40-year-old female, she failed 4 weeks of chiropractic flexion distraction, or Cox flexion distraction. Continued to have pain down her leg in a dermatomal-like pattern. That's called radicular pain, when the pain is just to the outside of the leg or the inside of the leg. If the whole leg hurts, it's not radicular pain. There's something else going on. So you order an MRI, which you should after 4 weeks of failed care, and we're going to take a look at her MRI. But first you better see what a normal MRI is. So this is a normal MRI. You can see the nucleus pulposus, and don't worry, we're going to cover this stuff like a million times, so you're great at it. You can see the facet joints right here. Actually, let me draw them. So here's the superior articular process, because this is an overhead view, right? And here is the inferior articular process. Would be right about there. Here's the lamina, spinous process. Okay, so this, you can call this whole thing the vertebral arch, if you will. Just kind of drew it all together there, but yep. Where's the pars interarticularis? The pars would be right about here. But this thing, this is the so-called facet joint, or the zygapophyseal joint. And that's the thing you're going to be treating all the time. It's filled with synovial fluid. It's got nerves that connect to it, you'll learn. Right? Those are medial branches of the posterior rami of the same level of L5. And L4 comes down and plugs into those again. And we'll go over that when the time comes. But here's the disc, nucleus pulposus. And then here's the nerve roots. These are called traversing S1 nerve roots, which have come out of the thecal sac. Here's the thecal sac. Right. Here's the S2 nerve roots. Here's the S3 nerve roots. Where's the L5 roots? They're right out here. All right, so there's the setup. So we look at the back of the disc here to make sure there's nothing sticking out the back of the disc and smashing one of these nerve roots. Right? That's the most common. There's other things that can stab. You could get a bone spur that grows into it and stabs it. It's all sorts of things. But we're looking for the disc. All right, so now let's look at this 40-year-old's MRI that you just ordered. Whoa, you see it? I can't see your faces, so I don't know if you're... Some of you probably figured it out. So this is, well, we'll just call it the disc. We're actually a cut below. This herniation was so big it actually extended down into the sacrum a little. But here it is. Gigantic disc herniation. And we'll cover that. We'll cover that more. There's these sides are reversed, so that's the right. That's the right S1 nerve root. The left is smashed right here. So that's why this patient has horrible pain burning down her leg, because of this giant disc herniation. And we'll learn more about that. Or you can go to my YouTube channel and you can really dig into that. Alright. Back to this thing. See anything strange about this sacrum? Anybody see anything weird? Well, what about this area? Hopefully you guys can see my little arrow here. I don't know if you can or not. I think you can. So here's the S1 spinous tubercle here. But it's formed by two lamina. But can you see we have a line right here? So that never turned to bone. It never ossified. So that's called a spina bifida. Spina bifida culta, actually. And it doesn't do anything, this type of spina bifida. Some spina bifidas are horrible. In fact, remember the little coccyx, the little baby with a tail, had a spina bifida manifesta, and the glute was all atrophied, and the baby will probably never walk. But these are benign. But when you see one weirdness, always remember this forever. When you see one weirdness, don't blow it off completely. Look harder for other weirdnesses. Because if there's one malformation, there's usually another malformation. In fact, there is another one right down here. The S4 sacral tubercle is split into two pieces. So that's another spina bifida there. Alright, see, isn't this fun? Alright, there's everything I just said. Great. And you're going to see this on your x-rays all the time. So there's the lumbar spine. Here's the sacrum. What's that thing? That's an IUD, birth control. But if you look closely, I blew it up. Look at the S1 sacral tubercle. Or actually, that's not S1, right? That's L4 if you draw a line through the top of the iliac crest. This is L5. Remember, you see one weirdness as another. So this is complete sacralization of L5. But look at this. I blew this up right here. See how the bones didn't fuse together into one unit? So that's a spina bifida. You don't see that there. See how that works? So easy, isn't it? Alright, one more topic and we're out of here. Sacral articular process. So it's this thing right here. There is... kind of having fun drawing. I don't get to do this when I'm in the classroom because I can't use this program. These little rabbit ears right here, those are superior articular processes, and there's a shiny surface, right? So that's the facet of the superior articular process. So you can call that, because there's only one of them, there's no other complete articular processes. You can just call this the sacral articular process. You could call it the superior articular process of S1. If specifically it's the facet of the superior articular process of S1. So a couple things you could call it. Remember, it's very clinically important. It articulates with the inferior articular process of L5 to form the L5/S1 Z joint or zygapophyseal joint or facet joint, which you're going to treat all the time. It gets degenerated because it takes more axial load than any other facet joint in the body. So you're a very clinically important area here. Okay, that's enough for your brains. We'll pick it up tomorrow. And I'll come check the chat right now to see if there's any questions. See you guys tomorrow.